you can't rest on a reputation. We have a lot of things going on. Ms. Parham and I meet every 2 weeks, and she's got some things that she's going to be bringing to the table for next year. And I want to just talk to you a little bit about that. Not resting with average. Do not rest. The push will continue to go to be greater. You're doing great work. We're very appreciative, and we want you to have a great day today. I hope to come back by because the wellness part of it, I really enjoyed last year. I can get in shape, and then I hear there's going to be some things sold at the farmer's market. I need some honey for my tea, so I hope to make it back by. I'm on the way over to Jackson, but I want you to have a wonderful, wonderful day, and thank you for all you're doing. God bless you.
Thank you, Mr. Cohn. So awesome, and well, we won't get into all the state schools, but it's a very good point. So what Mr. Cohn was referring to, you know, today after we have lunch, there will be the farmer's market. There's great items to buy, vegetables, fruits. There's also going to be some honey. I know that Audra had mentioned to me earlier that they've made arrangements with a local honey provider and flowers and all sorts of stuff. So that's going to be great. I hope everybody brought a little bit of cash to buy some good stuff to take home. And that's what we're looking forward to today after lunch. So I'm gonna, before I pass the microphone on to Wanda, I know I'm so accustomed to seeing Olga Botero here kind of dancing behind Wanda. Miss Botero's on vacation today, well-deserved I might add, so that's how come we don't see her. And Mr. Holmberg is at a meeting for construction, because you all know in your schools there's things that come up, you know, each school is on a plan for you know, bond initiatives, and that's where Mr. Holmberg is this morning, so if you don't see some of our folks. But it is true about meal participation, and I'm really happy, Mr. Cohn, that you mentioned briefly about the social media. My phone is not in my pocket today, but right? Are we seeing the students with the phone everywhere? Just this week, and I don't know that I don't know if I saw the manager here. I know Jairo's here, Mr. Garzone. I know I see Alvin from Mandarin Lakes. In case, and I think all of you know this, there's something called a DCERT message that principals or site supervisors can send. It goes to the whole district. Mr. Cohn gets every DCERT message for anything and everything. And it could be power outages. It could be there was a fire and the school was evacuated and the fire came from the cafeteria. But we know now, where was it? It was the air conditioner in the front office, right? I was just speaking with one of our managers earlier. So all of those photographs, a photograph of juice, that we've been through this with our training. We notice too that sometimes the kids do things that are fake. And there was a very upsetting picture of adulterated food that got sent on social media this week. And I want to say that the food service manager, the principal, our leadership, Mr. Garzone in our office, Ms. Prita, Ms. Torres, all of us, furious. And the principal immediately went, they found the student was disciplined for doing this. The food service manager and staff were informed and were also told that, you know, they were giving them the honor that this is your hard work and somebody is actually falsifying something wrong with it that then fuels some misperception. So that is nipped in the bud. Students are addressed disciplinary for that. And so your vigilance is not just so important to keep things looking good because they are good. It's very important to make sure that we don't become victimized by perhaps some bad behavior or a kid who wants to play a prank. You know what I mean? It's for all those reasons. So I really wanted to bring that up because we've experienced all of those things. And you have to maintain that quality assurance. You have to work with your staff every day. If something doesn't look right, take it off the line. When in doubt, never serve it. I'm so much happier if you call, tell Susan Rothstein, maybe the delivery wasn't right, call your coordinator, it doesn't matter. But once it's on the line, then we know it's perfect for the kids, right? Perfect. All right, well, saying all of that, thank you all. We're gonna have a great day, and I'm gonna give the microphone to Wanda.
Thank you, Ms. Parham. Thank you. you, Mr. Cohn, for coming. We appreciate you being here.
Anybody notice Miami? This is not Miami 1960s, 1970s. We got 70% of my patients are either Afro-American, Afro-Cuban, Afro-American, Afro-Caribbean. We are Latins. We are a lot females. 70% of my patients are females. Unfortunately, the publications that just came out, 60% of us are obese. Not good, way overweight. That's the core, that's the problem. How did we get there? Miami in particular, we're not doing enough exercise. We don't have good public infrastructure as far as transportation. We're taking cars just to get out to pick up the mail in the morning. Second problem that we're facing here, a lot of us are working 40-hour weeks. Guess what? A lot of us are pulling 2 jobs, 3 jobs to make ends meet. Where's the time to prepare a proper meal? Where's the time to do exercise? Okay. This is where the core problems start in. Once again, you won't get off, lifestyle stress, obesity. Well, that's what lands you in the emergency room with a heart attack. Let me mention something about this obesity and hypertension thing. That's the bread and butter. That comes before the heart attack, okay? And the way you fix that, we were very involved with bariatric surgery. We have 700 patients that have had bariatric surgery done. As they come down from 300, 350, 400 pounds, and they lose those first 100 pounds, they started out at 15 medicines a day. When they lose the weight, 0 medicines. Can you cure diabetes type 2? Yes, by getting skinnier. Can you cure hypertension? Yes, by getting skinnier. We see it every single day. I'm very proud of the bariatric surgery that's being done because most of these patients have never come back after a year or 2. They no longer have these conditions. What's killing folks out there? Why do we have these dialysis centers? Why do we have folks at the eye doctors having their retinas fixed? Why do we have open heart surgeries left and right in Dade County and angioplasties and catheterizations? It's because of the core things we started talking about. People are stressed, they don't have time to exercise, and not eating correctly.
Except that I do have to tell you, you guys do not look stressed out at all. None of you do, okay? Especially when you guys were jamming out at the beginning when I first got here, okay? Yeah. Stress is something that we experience from the moment that our alarm bell rings in the morning, okay? It is everywhere, okay? And we can't totally remove stress from our life. As a matter of fact, sometimes stress is good for us.
Okay, so then we can talk about food shopping. So we want to do food shopping, we want to do it smart, right? So one tip is to never go to the store hungry. Don't do that. Never go to the store hungry. You see me, little 5-foot girl, I go to school, if I go to the store hungry, I'm going through the aisles and I'm taking everything with me. You get in the car, everybody get in the car, like I'm going home and I'm feeding the Miami Dolphins. Don't do that. Don't do that. Have a snack before going into the store. I always keep something in my purse, whether it's a banana or an apple or peanuts or something, because when you're going anywhere and you're hungry, everything sings to you. The golden arches sing to you, the golden crown sings to you, everything is singing to you, and you want to stop and you want to have that food, and that's not the best food option. So that's just a quick tip.
How do you prevent cuts? Okay, they gave me this slide in terms of use the right knife for the right job, use a cutting board, learn to use the equipment properly that you're cutting with. Pay attention while you're cutting. Don't text and cut. Okay, and if someone's dropping a knife, don't run to catch it. Okay, you're probably going to end up in my office. How do you treat a slip and fall? Basic treatment for injuries, slips, falls, sprains, strains, is something that we always called RICE, which stands for rest, ice, compression, and elevation. From a work comp standpoint, we're not telling the patient, hey, rest, stay home, but you want to rest the area, okay? You want to use ice right off the bat. It's not a burn, it's a sprain, it's a strain. ice reduces the inflammatory response, it reduces swelling, it actually will prevent damage, and it's on and off for the first 2 to 3 days. Compression, put some pressure on it. You know, if there's going to be some bleeding underneath, the compression will control the hematoma. Elevation in rice is important because gravity is your enemy. You know, your body's got to get blood back to the heart to prevent things from getting too swollen and to get rid of the bad stuff. So anytime it's dependent, you know, things are going to swell and hurt more. If you hurt your ankle, if you hurt your knee, if you hurt your finger and you put it down, you're going to feel your heartbeat in the injury.
We also get calls about exposures to cosmetics, and you know, child eats a lip balm or you know, nibbles on a cigarette or something, but also pesticides. And then sometimes people do think about poisonous plants. These are not the most deadly poisons, right? By any means. So yes, you may have a venomous snake in your backyard. Chances are you don't, right? Right? We certainly all have cleaners and chemicals, but again, those don't tend to be the real dangerous things. So there are things in your home you may not recognize as being dangerous poisons, and as a result, we're careless. Your prescription medications. There's a reason that they're only available by prescription, right? But once people get them, they tend to be a little careless, right? We think of medicines as being helpful and positive and good, but that's only part of the story, right? So our #1 cause of poison death in the United States right now is medication overdose. And that's what's driving our deaths in Florida, those 7 deaths every day. It tends to be people who have overdosed on medicines for pain in particular. Okay, so if you have medication at home that is for pain, is for anxiety, anti-anxiety, medicines related to stimulants, so that can be ADHD medications, things like that for maybe somebody in the home. These are all potentially deadly poisons, right? That might not be on
potatoes.